representative, I will be on the government side where I support the legalization of cannabis. First point.
Now, let me come to my next argument, which is the relief of the use of marijuana by teens.
There are plenty of benefits in legalizing cannabis. We, as the opposition team, could not agree in doing so. Ladies,
Yes, I agree with you, Maya. But although marijuana has its own benefit, I will still believe we need to think of the
Assalamualaikum and very good morning. Today, our team will be having a debate on a topic called cannabis should be legalized. As a full representative, I will be on the government side where I support the legalization of cannabis. First point that I will be discussed is about cannabis give beneficial to health. As we know, cannabis have been used for medical purposes across the world for centuries. Cannabis may relieve chronic pain as effective as opiates and other commonly used treatments. For your information, there are two types of well-known components which are cannabinoids CBD and tetrahydrocannabinoids THC. The review found that cannabis or product that contains cannabinoids are effective at relieving pain. Based on article Cannabinoids and Pain, New Insight from All Molecules 2018 have shown that CBD may help reduce chronic pain by reducing inflammation. This is shown when CBD helps to decrease oxidative stress and systemic inflammation by acting as an antioxidant. It may also decrease inflammation by preventing a reduction in microelements like zinc and selenium, which are important actors for a balanced immune response and may reduce neuropathic pain. So, this already shows that cannabis help in medication sector that give benefit to people.
it is undeniable that we must utilize whatever that is considered as beneficial for the sake of advancement of our society. Although there are plenty of benefits in legalizing cannabis, we as the opposition team could not agree in doing so. Ladies and gentlemen, we gladly tell you that the government team are fighting a losing battle to start with. First and foremost, Assalamualaikum warahmatullahi wabarakatuh, and a very good day, everyone. I am the first representative of the opposition team, and I am going to rebut back whatever the government team have presented, and afterwards, I will give my arguments that does not support the motion. As what Ms. Daya have mentioned that CBD give beneficial effects towards the health, she fails to mention that CBD has the side effects that everyone needs to be concerned about. Based on a study by Dr. Greenspoon from Harvard University in the year 2021, a person who consumes cannabis in their medication will experience nausea, fatigue, and irritability. Well, that is the minor side effect. However, the worst case scenario is that the CBD that contains in the cannabis will increase the level of blood thinning, and it causes other medicines that you consume competing for liver enzymes that break down all the drugs in your blood. Moreover, the dosage and purity of CBD in medicine is truly unreliable. A study proves that 84 CBD products that are purchased online have a quarter lesser than the CBD that is labeled in the product's container. In addition, THC is found in 18 medicinal products, which brought to my arguments that related to health. The other cannabinoid that is called tetrahydrocannabinol, THC, have the side effects in affecting a person's mental state. As you know, in cannabis, there are two major cannabinoids, which are CBD, that Ms. Daya have mentioned, and the other one is THC. It is known to be a psychoactive component in the cannabis. So I believe one of the core reasons on why the Food and Drug Administration, FDA, does not approve cannabis to be applied in medicine is because it causes addiction and makes you feel high. This could lead to anxiety, schizophrenia, and psychosis. Besides, the Drug Enforcement Agency have also classified marijuana, as in cannabis, in Schedule 1, which is considered as the most dangerous drugs of all drugs because it has high potential of abuse, addiction, and makes you feel high, like what I have mentioned before. And lastly, the quantity of THC has also increased steadily from 8% to 12% in the year 2012, as shown in this slide. This is because scientists and technologists and even pharmacists want to make more effective marijuana medication for the sake of our people. Therefore, we are firm with our stand that cannabis should not be legalized in terms of health and medical because it brings a lot of adverse effects towards humans' physical and mental health.
We, as the government team, strongly do not agree with the statement given by the second speaker, where she stated cannabis has the ability to affect a person's mental state. This statement is very false as cannabis actually can help to reduce mental disorder. For our information, mental disorders are commonly treated using a drug. So, cannabis that contain CBD help to reduce mental disorder. Based on article Cannabis as a potential treatment for anxiety disorder, found that CBD could be effective in treating generalized anxiety disorder, panic disorder, social anxiety disorder, and post-traumatic stress disorder. CBD helps people to relax and have a good sleep.
As the opposition party in this affirmative, I would like to present my point as saying legalizing cannabis increased use by teens with harmful results. The number of teens who use marijuana is going up. In fact, more teens use marijuana now than any time in the past 30 years. Some people seem to think this is because the drug is now legal in many states. A study that looked more closely at 11 states where pot is illegal showed that this assumption was wrong. According to the study, it is actually harder to get marijuana in the state where it is illegal. To sell marijuana, dispensers need illegal permission and proof of age. This means that more people are getting marijuana through legal channels. Even though it is harder for teens to get the drug, they are able still to do so. So how many teens use marijuana today? Currently, teen use remains at its high rate in the 3 decades. According to a 2019 survey, large percentage of middle and high school students reported past year marijuana vaping, which is 8% of 8th graders, 90% of 10th graders, and 22% of 12th graders. So why do teens use marijuana? Teens often start to use marijuana because they are interested in it. Teenagers might want to try marijuana if they see their friends do it or hear about it in the social media. Teens more likely to use drugs when they are not around other people who use them. Some people find it easier to get marijuana than alcohol because it comes from plants. They think it is safer. In 2019, teens are more likely to smoke cigarettes that made from marijuana than cigarettes made from tobacco. As marijuana use becomes more accepted in our society, more and more teens see it as a way to get high.
Okay, thank you, Islisha. Such an outstanding argument given from you. But unfortunately, I'm not agreed with your point. For me, legalizing marijuana result in decrease in marijuana use. Because a researcher at the Washington University School of Medicine found that the rate of marijuana use by young people are falling. Despite that, the fact more US states are legalizing or decriminalizing marijuana use, and also the number of adults using the drug has increased. And according to a December 2018 report from RAND, marijuana use among 8th graders in Washington state decreases following legalization in 2012 from 9.8% to 7.3% in 2014 and 16. The Marijuana Policy Project, an organization that leads marijuana legalization campaign, said study after study has confirmed that marijuana policy reforms and do not cause rate of use marijuana use to increases. Now, let me come to my next argument, which is the relief of the use of marijuana by teens. Dr. Darshan Singh, Center for Drug Research, University of Science Malaysia, said that they actually use cannabis for many reasons. You also have people with medical disorder, like for example, they have diabetic, they have hypertension, so they actually use cannabis for a therapeutic reason. Also, thematic analysis revealed that these teens differentiated themselves from recreational users and positioned their use of marijuana for relief by emphasizing their inability to find other ways to deal with their health problem, the sophisticated way in which they titrate their intake, and the benefits that they experience. And these teens use marijuana to gain relief from difficult feelings, including depression, anxiety, and stress, difficult sleep, problem with concentration, and physical pain. Most were not overly concerned about the risks associated with using marijuana, maintaining that their use of marijuana was not in excess and their use fit into the realm of normal. Marijuana is perceived by some teens to be only available alternative for teens experiencing difficult health problems when medical treatment have failed or they lack access to appropriate health care. Plus, marijuana is less harmful than alcohol and tobacco, which are already legal. So why can't we legalize the less harmful substances rather than the more harmful one?
Yes, I agree with you, Maya. But although marijuana has its own benefit, I will still believe we need to think of the dangers of marijuana use with teens. So what are the risks of for teens who use pot? Even though teens who use marijuana a lot, there are some risks that both teens and their parents should be aware of. Inhaling smoke from marijuana can hurt your lungs. Can hurt other mental illness in the teens who are already prone to them. Also, people who use marijuana every day are more likely to be depressed before they turn 21. Since the brain doesn't finish develop until the mid-20s, teens who use marijuana can also hurt their development. This means that teens who start smoking marijuana at a young age can become stuck in their development and emotionally stuck at the age they started. These are risk factors for not having enough ways to deal with problems, which can lead to lifelong need for drugs to deal with feelings. As conclusion in the opposing party, cannabis should not be legalized because cannabis can give negative effect to the human body and their mental health. Also, the use of cannabis among the teenagers became increasing. Thank you.
And as for the government parties, we can conclude that marijuana has many benefits, especially for health and teens. In terms of health, cannabis is beneficial to health and CBD help to reduce mental disorder. While in the aspect of teenagers, legalizing marijuana results in decreased in marijuana use. Therefore, we strongly agree that cannabis should be legalized. And ladies and gentlemen, that's all from us. Thank you.
Thank you.
Thank you.
Thank you.